All right. Um, Welcome everyone to this session on choosing neurology and neuroscience as a career. And we are glad to have Dr. Hemant Pandey over here for our amazing guest speaker today. And just a brief introduction for Dr. Pandey. He is a practicing neurologist and the founder of three companies, Brain and Spine Center, Neurons, and MD First Research. The company's focuses are respectively delivering care to patients with dementia, providing EEG monitoring services, and conducting research on neurological diseases. During medical school, Dr. Pandey developed a fascination with neurology, particularly the ability to diagnose and treat based on detailed neurological exams. In Phoenix, Dr. Pandey served as a stroke director at the Chandler's Regional Hospital, where he established protocols in the ER and with EMTs to ensure prompt care for stroke patients. And simultaneously, the Brain and Spine Center was founded by Dr. Pandey, offering neurological care to the community. And Dr. Pandey also wanted to highlight that whether as a neurologist, scout dad, or a Jumaya teacher, or host of Indian festivities, serving others brings him joy and is a privilege. And let us please welcome our first speaker of today, Dr. Pandey. Dr. Pandey, you can start your screen share now.
Yeah. Okay. Well, thank you, Michael, for that wonderful introduction. Thank you, Alexia, for allowing me to come and talk. It's always great to interact with the new generation and let them look at neurology, neurosciences from their lens. If you ask people what neurology means to them or neuroscience means to them, all the practitioners will give you their version. So this is my distilled version. This is my version. It kind of describes the journey that I have taken in the last couple of years. I wanted to give a little snapshot of what neurology has been in the past and what neurology has to offer in the coming years, so that you can look at it from your lens and then you can make the choices based on the information that I will be talking about. What is the definition of neurology or neuroscience? I think every practitioner is very passionate about what they do. I actually look at neurology more from a philosophical perspective. There's a debate about the consciousness definition. What exactly is consciousness? Is it something that's, you can touch, you can feel? Is it part of the brain or is it not? The three main definitions that people are debating about is it's omnipresent, always there. It has no beginning and no end, and it's beyond the space of time. And I think that's what neurology has been. That's what we are getting to know about neurology, and that's what neurology will be in the coming years. Let's see. Okay, so everyone has a story. What really got me here were two very major events in my life. One, my 98-year-old great-grandmother, she had a stroke. I can now localize it. It was ataxic hemiparetic stroke. She was unable to move the dominant side and had a lot of clumsiness with it. I saw the impact of stroke on her, on my family as a caregiver, and that really left a lot of questions in my mind. The second experience was the patient in my med school. Young guy came with myasthenia, completely paralyzed, and we gave him edrophonium, which is an IV push, and he woke up. So both of them, brought in some very sweet and bitter experiences. One where the care of neurology happens over a period of time. Second, where you can see some real-time difference in a patient. Specifically, if you're a child neurologist, you will see that. So as Michael has mentioned, gone through different stages of life with my med school residency in West Virginia. My fellowship was at MD Anderson in Houston. It was a fascinating experience. I met with some of the most brightest men and women. I saw the humility. MD Anderson hosts the maximum number of Nobel laureates. I met Dr. Kendall Schwartz in the cafeteria. I was biting on a sandwich when I approached him and I interrupted his meal. And one of the most fascinating, neuroscientists that I've met at that time. He's the father of all the channel diseases. We moved to Phoenix, and I was given the opportunity to run the stroke program at Chandler Regional Hospital and Mercy Gilbert Hospital. So this really changed my perspective on the practice of medicine. Chandler Regional is heavily run by board members, and I was able to interact with the community at a very grassroots level. We would talk with the EMS, we would talk with the Sun Life retired community, telling them about the relevance of stroke, the timing of stroke, and that was very exciting. During that period of time, I started my practice, and somewhere in the practice, I realized that I was not able to offer everything that was there to offer. And that's when I started our research program. Our first trial was on patients with Alzheimer's dementia. Unfortunately, the trial did not do well. Subsequently, we have now done about 35 trials, and some of them have come on to become part of the clinical practice and has been an exciting journey. I think I'm a functional ADD, and that's when the bug of entrepreneurship kicked in me, like about 5 or 7 years ago. There's a myth that people say that most entrepreneurs are young, and that's not true. Most entrepreneurs are predominantly of my age for many reasons. There's added wisdom. You are, a collection of some good friends and influences, and I think you also have the finances to support it. Okay, so the way I would like to present this is what are the top 10 reasons for you to pursue neurology or pursue neuroscience as a career, right? The very first reason is the crux of neurology, which is localize the lesion. As Michael said, neurology is all about neurological exam. A lot of physicians do not like neurological rotation, or they purely send patients because exam is long, exam is very detailed, and exam is very painful. And the reason exam is very critical is because at the end of the history taking and at the end of an exam, with your Sherlock Holmes cap on, you start to localize the lesion. You figure out where the problem is or what exactly is going on. Because it is so exam-based, it has some very added benefits and advantages. This is something where AI won't be able to really replace in the coming years. And this is something where we have seen that while imaging helps in terms of getting to a certain conclusion, it acts as an adjunct. It does not replace your clinical exam. So for example, I saw a patient last week, 45-year-old young female, came with foot drop. She could not lift up her right foot, and I examined her. She had weakness in the foot. The knee reflex was very brisk and very jumpy. And that told me that the problem was in the main highways or the freeways, or what we call upper motor neuron sign. If the knee reflex was absent, it would be on the local roads of peripheral nerve. So a very basic exam like that helps me differentiate between what is upper motor, what is lower motor. And then she also had what we call a sensory level. So right around the bra strap lining, there was a loss of sensation as I was scratching her. And that creates what we call a sensory level. And based on that sensory level, I could predict that she probably had a problem in her T4 area of thoracic spine, which is exactly where her demyelinating lesion was. So exam is very critical. This is one of the only this is one of the only sciences where exam is not defunct. The cardiac sounds are not replaced by echocardiogram. The lung sounds are not replaced by X-rays or CT chest. You still have to do a very detailed exam, and that's what gets you bonus points. Exam is also very critical because it helps us understand where the problem is in the nervous system. So for example, if someone has crossed sensory signs, which means they have facial numbness on right side and numbness of the body on the left side, you know that the problem is somewhere in the midbrain or the medulla where the fibers cross over, right? If somebody presents with neglect, they are not able to see things on the right side, or they're not even able to identify their extremity on the right side. I had a patient, I showed him his hand and I asked him, whose hand is this? And he said, well, that's your hand. I'm like, it cannot be my hand, look at the color of the skin. So there's a neglect that comes from the parietal lobe. And so exam is extremely fascinating, extremely detailed, and that's where majority of the neurology begins. Now, once you have the exam, the second part of pathology is it helps us identify the lesion in the brain. So for example, if a patient comes in and she has what is called Alice in Wonderland syndrome, she sees people around them that are very large, very Lilliputian. We know this is a very specific seizure type disorder coming from the right parietal temporal area. If somebody has intractable hiccups, we know it's coming from the medulla. If someone has the syndrome that was written in a book called Man Who Mistook His Wife for a Hat. It's a very specific kind of dementia that comes from the back of the brain. So there is a visual association disconnect. Some very fascinating syndromes that you will see in neurology based on exam, based on history. If a young kid comes with a seizure where she presents with excessive laughter, that's a gelastic seizure that comes from the hypothalamus. So, and this is what was very fascinating, when I was in med school or residency. And I think I still, one of the kick that I get when I leave a patient's room is a very detailed neurological exam, and I know exactly where the problem is. Am I right all the time? No, not at all. I think the MRI proves us wrong on certain times, but there's always a learning experience to that. Okay. The second big reason to choose neurology is it has zillion specialties. When I first started, about 70% of general practitioners were general neurology. And then we started to realize, as Mr. Keller said, find out one thing that you're really good at and make it your niche. And that's what started to happen. As we developed the endovascular part of the neurology, the growth in the intraarterial TPA or intravenous TPA grew significantly. As we invested into behavioral neurology, the work of dementia, grew significantly. Everything on the left side are the specialties I have. Contrary to what I just said, have your niche. I've always been scattered, and somehow I've been able to find my purpose. On the right side are the specialties that I don't have, and I hopefully, next time I'll be able to get the experience. It's also important to know about the different specialty because it helps you understand, or it helps you choose who you really are, what your personality is. If you are a busybody, if you want to keep yourself extremely busy, then endovascular neurology, where you are doing acute stroke care, coiling of the aneurysm, is probably your cup of tea. On the other hand, if you are a really chilled out guy, that does not like to be in the ER, have, long hours, and your sleep is very important, then you probably want to be either in neuroimaging or probably in the world of dementia care. If you love kids, it's child neurology, beware of the parents. It's a very fascinating field, but it comes with all the anxiety of the parents. So many options to choose based on what your personality type is, what your choices are, and what really gives you the joy. Okay, so the third one is something that has really gone through some very major changes in the coming years. So EEG was first designed in early 1950s, and the purpose of the EEG was essentially to recognize what is the brain activity like, and based on the brain activity, is the person in the wakeful state? Are they in stage 1? Are they in stage 2? Or are they in deep sleep? Thereafter, we started to use the EEG in seizure detection, where it's predominantly used to find out what kind of seizure is it and where is it coming from. EEG has also been very critical in identifying patients who have who are brain dead because of anoxic brain injury or firm trauma. But these were the practical implications of EEG recording for the last 30, 40 years that was practiced in the neurological clinic. But that's changing. Okay, and it's changing because of three very major reasons. Number one, the technology is advanced. Now you don't have to have the 20 electrodes that you place like this, which you can see over here. It's done by the technician. It's a pretty detailed task, takes about 10 to 15 minutes of hookup. Now you have a lot of gadgets that automatically follow that pathway and record, which are just, place on and make the recording. You're probably also familiar with the Muse software, which has limited electrodes. So the data gathering has become very simple, okay? Number one. Number two, the data gathering is in the cloud now. So it has access, so AI and the large language models have access to the data. So not only are we looking at the patterns of sleep and the patterns of seizures, we are also looking at how does the EEG change as the person ages, or if they start to develop memory loss, dementia, or when they have an anxiety or a panic attack, or when they have any kind of a mood issue. Because we are now learning that there are biomarkers on the EEG that can help you understand the mental state of an individual. So the growth has been in the data capture, in the data storage, and then the third and the largest growth has been in terms of data usage, right? So based on whether there's an alpha activity or there's a beta activity, you can kind of predict if the person is in a very anxious state of mind, if there's a workload issue, if there's a memory recall, or maybe if I do a recording on you right now, I can say you are not engaged, the caffeine has not kicked in, and so far. And then you can club it with different kind of additional recordings, such as eye tracking to see if there is an attention, facial expression to see if there is an emotional decoding. And then you can attach skin recordings to find out if there is an emotional arousal. So the EEG has a lot more to offer in the coming years. And that's where I have been approached by Sephora and Zara for neuromarketing, where they want my data to use as an AI tool to create biomarkers. And then with the biomarkers, they can see how the customer is going to react when they are given choices such as certain form of a dress or a certain form of a color, because the EEG can be used as a tool to appreciate emotional response, decision making, instinct, and all that. So fascinating, trajectory of this recording technique in the coming years. We have an EEG internship program. Neha has been helping us out with it. It's a program will teach you how to learn EEG, how to code it, how to understand different aspects. So if any one of you are interested, you can you can join this program. It's also remote. The next biggest thing to consider in neurology is for patients with memory loss, a medical term called dementia. So why is this important and why is it critical? Well, the population is aging, right? So we are going to go from 5 million patients having Alzheimer's in 2014 to approximately 14 million people in 2060. So it's a big jump. And as I said, the disease does not just bring in disability for the patient, but it's a caregiver burden. The entire family is geared to take care of patients with memory loss. So this is going to be a very expensive healthcare issue by the 2050 with a cost approximately 1 trillion. And I think what I am really worried about is how I see my caregivers really burn out when they have to take care of their loved ones. The support system is not as robust. And people end up either leaving their job. One of my very close physicians closed her practice and moved to Florida to take care of her mom with memory loss. So Alzheimer's dementia, specifically of all different types of dementia, is going to be very critical. Now, this is what is very fascinating and magical, and this is something that we have discovered and put to clinical use in the last 2 to 3 years. So what you see on the red curve is a normal progression from healthy, normal cognitive function to a function called mild cognitive impairment, where you know what's going on, and you can do simple tasks, but you cannot do complicated tasks, right? And then it slowly progresses into dementia, where even simple tasks like bathing, feeding, cleaning, and all that becomes a problem. Having said that, 10 to 15 years before the onset of symptoms, we are now able to identify biomarkers. We are able to identify biomarkers such as the amyloid, the tau, and the neurofilament. We are able to identify them in blood. We are able to identify them in spinal fluid, and then we are able to identify them in the PET scan. This was available in research for the last 2 or 3 years, but now this year they have become commercially available and available to offer to our patients. So this is going to be a huge leap in the next 5 years. You will have patients who have positive amyloid, but no cognitive issues, and then we have to make a decision as to what we do with them. The second most exciting thing that has happened in the world of dementia is there are 3 new drugs that have gotten approved for the very first time this year. Actually, 2 of them have gotten approved. One of them probably will happen in the next couple of months. Lecanemab and aducanumab remove the amyloid from the brain and helps prevent the progression of dementia. For the first time, we have patients whose memory loss can be treated and not just modified. So I do want to tell you one thing, which I think is relevant to all of you. Sleep is very critical for amyloid. In your deep sleep, you essentially wash the amyloid from your brain. So every time you're taking a nighter out, just remember this conversation. The other part of dementia is neuropsychological testing. Neuropsych testing is a very elaborate 2 to 4 hour test where we look at specific issues that are causing the memory problem. So for example, in young adults, The most common cause is inattention, ADD, mood and depression that can also cause dementia. So it's a battery of tests which is offered to patients. Very interesting test. If you ever get a chance, I would advise you to kind of take it or work through it. And it tells us different functionality of a different person. We offer a program in our clinic where you can come and learn about neuropsychiatry, offer psychometric testing in the practice. Okay, number 5. Well, this is my favorite. This is the reason I think I'm heading into the deeper part of neurology is neuroscience and philosophy, right? For the last 25, 30 years, the big debate has been, where is consciousness? Is consciousness in the brain? Can we image it? Can we record it? Can we get an EEG finding on it? Or is the consciousness not in the brain? What happens when people go through near-death experiences? Into the Thin Air, a really good book written by Dr. Kalinthi from close by here in Flagstaff, talks about his experiences as towards the end of his life as he was suffering from cancer. So near-death experience has given us a very different insight about what consciousness is. If you look up the TED Talks, probably you'll see zillion tech talks on patients from different experts on consciousness. So the reason I bring this up is if you have an interest in religion, if you have an interest in philosophy, then neuroscience is going to be on your side, and you will probably be knowing a lot more about the functioning of the brain. Now we have a scientific proof for that. This is from Nature. We are able to map about 200 areas in the brain that do different functioning. Last year, we identified a small area in the precuneus that identifies who you really are, your existence, your identity. So imagine if you have a damage in that area, then you develop dissociative disorder. You don't know who you really are. There's a syndrome that I had talked about earlier, the Capgras syndrome, where the person sees his wife but does not recognize the visual input from the face, or does not recognize the emotional input because there is damage in certain areas of the brain that's connected. There is the guy who created music for Game of Thrones, Ramin Dojadi, I guess is how you say his name. He has synesthesia. He sees music as numbers because the auditory cortex and the number cortex are misaligned or misconnected. So this is very fascinating. It tells us what we do, why we do, and who we really are. Different functions of the brain. A lot of the people, a lot of you are into meditation. The goal is essentially to use the cortex to calm the limbic system. It's the limbic system that's on the fire, which has the fight or the flight modality. And in patients or in people with trauma, it's on a hyperarousal mode. And essentially all the meditation, all the mindfulness is to calm that. So that's where the role of this functioning comes. This is a very big scheme, as we have talked about, is everything which is external to us, is that really a visual mirage? Is that a simulation world that the mind is creating and behaving onto it? So it's inside out versus outside in. Those are the talks. These are some of the most fascinating talks I would highly recommend if you have an interest in neuroscience, if you have an interest in knowing how the brain works and the philosophy behind it. Oliver Sacks was one of the pioneers in neurology and talked about hallucinations. Anil Seth from Canada, fascinating statement. When we agree about hallucinations, we call it reality, right? So everyone sees it as red. One person sees it as blue, and we say he has a hallucination. Well, what if we are wrong? Dr. Ramachandran, he's one of the eminent neuroscientists at UC San Diego. If you ever want to pick up data sciences, neurology, neurosciences, I would recommend working with him at UC San Diego. And then Antonio Damasio is a very, very bright neurologist, again, on the West Coast, that came up with the entire concept of neurocognitive testing. These are really good TED Talks. I would highly recommend listening to them. Okay, so the next, going from philosophy to what we call gene therapy, right? So the last 4 years were fascinating. For the very first time, we have 3 gene drugs that got approved, and they got approved for diseases which were otherwise life-threatening. So patients with spinal muscular atrophy, patients with Duchenne muscular atrophy, and patients with amyloid neuropathy, we essentially had no cure for them. And now with gene therapy, we are able to provide some treatment. Duchenne muscular dystrophy is specifically a very disabling disease. The child is normal until he's 13 or 14 and then starts to lose his motor functions. and eventually with a very bad outcome. So this is very, very emotional for a lot of child neurologists. The three different approaches are RNA interference, splice modification, and gene therapy. So some of you who are wanting to go into bench science, who wants to do basic sciences research, this is going to be a very interesting field for you in the coming years. As you can see, 32% of the market is neurology, and we are going to see some very exciting things in the coming ages. Very good. So other reason, all the subspecialties that I talked about has had some very massive breakthrough in the last 4 or 5 years. This is a very exciting time. I mean, there's a reason I'm so emotional when I talk about neurology, and I can talk for hours. The very first drug that was approved for migraine was sumatriptan, and this was in 1992. Now imagine the patient suffered until then, until 1992 to now, as we didn't have a lot of breakthrough drugs. We borrowed drugs from other diseases. And then in 2018, we have a breakthrough of a very specific molecule called CGRP that has changed the way we treat migraine. Similar, I think, breakthroughs are happening in patients with mood disorder, addiction. There are now data coming that MDMA or psilocybin is effective in patients with refractory depression or refractory PTSD. Some of the very big neuroscientists like Sam Harris talks about use of medications or MDMA or psilocybin for patients with different neurological diseases. My 2 cents, use meditation as an alternative. Don't go this route. Meditation is controlled. These so far are not controlled. So this is exciting. This is actually, when I was in UT, I worked with Dr. Jim Grotta. He came up with the concept of putting a CT scanner in an ambulance. So when I was a stroke director, the goal was to give clotbuster drug to a patient within 45 minutes to 1 hour. If we got 45 minutes, we would celebrate. Now, as you have a CT in the ambulance, you can look at the brain, make sure there is no bleed, and give the patient the clotbuster drug, and the time has gone down to anywhere between 15 to 25 minutes. So time is brain. This is fascinating. The other thing that has happened in the world of stroke is you can now go to the site of blockage of a large vessel disease, as you can see over as you can see in slide A, and then you can open it up with a TPA, which is a Drano-like drug, to open up the arteries. So now this, if some of you who really want hand-on medical specialty, who want to sacrifice your sleep and your overall life, go for interventional care. So the neurology specialties are evolving at a very fast pace. These are all the drugs we have in MS. It's very hard to now manage a patient with MS due to the complexity of the diseases and the options we have. And this now actually got approved 2 or 3 years ago. This is a very high frequency ultrasound that you target at a thalamus to basically make a small puddle or a scar tissue called thalamotomy from an ultrasound guided tool. And essentially it's for patients with tremor, both from Parkinson's and from essential tremor. And you can see the difference below. Some very fascinating things that are happening in the world of subspecialty. What else? Well, neuromodulation. So I think neurology went from the science of a physical exam diagnosis, and people would complain that, well, you don't have much to offer, then to pharmacology, as I talked about the evolution of drugs in migraine, MS, and stroke, and now to neuromodulation. These are certain devices which are used for migraine. You put it in the supraorbital area, you stimulate your nerve to abort a migraine attack. So people, patients who don't want to go on medications, essentially use this. This is a device which is used for patients with Parkinson's. Essentially, you put a probe right at the deep brain, right in the ventrointermedial nucleus for tremor, and the GPI for Parkinson's, and you turn it on. And there are some very fascinating videos on YouTube. You can see the tremor go from pretty significant high frequency tremor to actual no tremor at all. We have the Barrows does this procedure. We have close to 50 or 60 patients in our clinic on this. So not only is it going in tools of treatment, it's also moving into other areas of neurology. So on the far left, you will see a small wristwatch that's used for patients for tremor. It's a Kela device. You turn it on and essentially takes the essential tremor go away. The one in the middle is a vagal nerve stimulator. It's a device that goes on the vagal nerve. And then the family has a small band, and you swipe it on the chest and the seizure stops. So a really interesting, a really good tool to abort the seizure as you're having an aura. Now, this is again one of my favorite. I'm deep into AI. I think AI is going to help us understand part of neurology that we could not. So AI is making big leaps. There are two major areas where artificial intelligence is really impacting the world. One is neurology. The other is oncology. So I think if you look at neurology, it offers some very unique combination. You can offer empathy by being a physician and by doing a detailed exam. You can offer treatment with medications and with neuromodulation. And now this whole world of AI is opening up to look beyond. So some of you who are interested into biomedicine, who are interested into software, and the coding, this is the place to go. So on the left side, the MIT guys came up with a technique where finger tapping is used as a mechanism to diagnose Parkinson's. On the right side, they are using the phonia, the tone of the voice, the loudness of the voice to detect early Parkinson's. And then this is a tool in the middle we are actually beginning to use in my clinic, which is called Suno, which is a English term, Hindi term for the word listen. It transcribes your entire conversation. So you turn it on, it listens to the conversation, makes a decent note, and then orders all the tests for you. So some really fascinating journey. Now, this got published in New England Journal. Elon Musk is not crazy. He is on the right track. This is about putting a small device in the brain called BCI, brain computer interface. And what they were able to do is you were able to put it in the certain areas of brain, and you were able to use the non-functional vocal cords or the muscles of the articulation to communicate. So the chips were able to understand the thought process of what the person was thinking and able to spit it out in terms of as words on the computer screen. So really fascinating article. And now there are a lot of BCI experiments or work that's happening specifically at Stanford. There are a lot of other published articles as well. And finally, I think, we all want to make sure that we pay our bills. So the other reason, it's just to give you a little snapshot of where the neuroscience is heading in the world of finance. Um, the global market is pretty huge for neurosciences. As you can see, we are almost going to be a 10 to 15 billion-dollar industry in the coming years. They are predominantly into three different areas. Diagnostic tools, as I talked about EEG, as I talked about gene testing, drug therapy, specifically gene drug testing, and app therapy, actually, and then non-drug therapy, which is use of the AI modalities or use of the neuromodulation. So the world is really cool. My kids would say neurology is old and neurology is lit. We offer multiple opportunities, to experience neurology through the EEGs, the internship program, the research program, and the neuropsychometry testing. Just reach out to us. Happy to give you that exposure. Happy to give you the understanding. I think the reason I wanted to break it this way is based on who you are, based on what your skills are and what your needs, what you really like, you can pick up that aspect of neurology, whether it's coding, whether it's being a clinician, whether it's being a researcher, bench science researcher, and so on. Thank you so much for your time, Michael. Let me know what's the next step.
Yeah, thank you so much for the amazing presentation. I think that was super comprehensive. Honestly, as a bench side, I'm going to a PhD program afterwards, so I'm definitely on the bench side. But how I got attracted to the field of biology in general was because of neurosciences philosophy aspect. So I really appreciate how you address that. And I think there was an earlier person, one of our attendees had said that several cases you mentioned was from this book called The Man Who Mistook His Wife for a Hat by Oliver Sacks. I'm just putting it there for our attendees right now in case you want to check it out. Is largely about just interesting neurological cases that Oliver Sacks had personally experienced and summarized, or kind of just summarized. Yeah, I saw also a lot of great questions. So from our audience, so we'll just dive in. I think the first question will be what is this? What is some of the most promising research that you are seeing in the field to improve neurological care? I think this probably is more so toward the care's perspective than just gene therapy or new modalities in general.
Oh, I think so. The care is actually coming from two different aspects. One, of course, offer a lot of treatment from the on the gene side. For example, as we talked about the removal of amyloid in patients with Alzheimer's, there is new one of the research we are starting is we are shutting down the gene that makes amyloid. So there is silencing of the gene that makes amyloid production. So that's going to be great because the side effects are very limited. I think the other aspect of the caregiver is the tools which are coming up in forms of apps, in forms of developments. So some of our students have come up with tools to monitor their grandparents who have Alzheimer's from wandering, from fall risk. There's a lot of other very interesting AI tools which are coming up. You can have video monitoring set at home that can detect if the person is at fall risk. So the care evolution is happening not only in the world of clinical practice, but even outside the clinical practice in someone's home.
Gotcha. Thanks so much. And I guess like I'll just because it's time, I'll just dive into the next question. Um, this person was wondering like what was your pathway into neuroscience and neurology within the medical field? I guess like a little bit more so on the personal perspective.
I think I told you about my great grandmother. So she taught me a whole bunch of things. I come from a small village. She would teach me how to do knots in the village. We had a farm. She would have taught me how to, milk the cows and all that. So I was very close to her. So when I saw the stroke, it really just kind of I think to see and to take care of a patient with neurological disorder leaves you with a very significant impact. If you have never done it, I would highly recommend it. To see your loved one wandering, look at you, not recognize you, to see your family members not being able to use their dominant function can be very, very distressing. So that's where it started from. But I think what really got me into was the neurological exam. A typical neurological exam is 15 to 20 minutes. And if you do a detailed neurological exam, such as a neuropsych testing, it can even go to 20 and 25 minutes, which is neurology is the only field where exam becomes a very major critical part of the clinical encounter. And I don't know, I think as time went out, the stroke took a very major breakthrough with intraarterial work and now with dementia. It's been fascinating. I was not expecting that the field would blow up like the way it has.
Really exciting. And honestly, I think as a I guess a current still EMT, if for our pre-med student or like just pre-health students today, one of the most best way, except for like shadowing or for scribing of like, actually doing hands-on neurological exams is to be basically EMT trained because part of your training is to provide some preliminary diagnosis or at least sense of like what neurological exams look like. So I would highly recommend that. And yeah, the next question will be like, what are some of the best ways? This is a really interesting one. What are some of the best ways to care for your own brain health or just neurological health, I guess?
Oh, fascinating. Yeah, yeah. So this is a big topic. I'm beginning to actually talk in the local community, and I've given like a close to five different converse talks in the last 6 weeks. Five things. Okay. Number one, sleep. You got to make sure you sleep 7 to 8 hours, unless you are a short sleeper. So there is a gene which is called a short sleeper gene. I think Obama has it. Some of the successful guys in DC have it, where you can sleep less than 5 or 6 hours and you can still be okay. But for everyone else, 6 to 7 hours of sleep is important. Why? Because when you go into deep sleep, that's when the glymphatic system cleans the brain. So Matthew, oh boy, I forget his last name. He's a very big sleep guy, and he has a book written "Why We Sleep," and he talks about how the glymphatic system cleans the cerebral amyloid function. So sleep is very critical. Okay. Number two, exercise. I think more and more data is coming that it went from 3 days a week to now 5 days a week, now to 6 days a week. Strength training along with zone 2 exercise, very important. Number three, socialization. So we saw in COVID how socialization is so critical. Yes, Matthew Walker, thank you so much for somebody spelled out Matthew Walker, and it's fascinating guys, some really good podcast. So socialization is very critical, specifically for your generation. Your visual field is now limiting to large screen or small tablets. So I think I think I think socialization is critical, and we saw the sides of it during COVID. So that's the third one. Fourth, alcohol. So alcohol got debunked this year. I'm very sorry about that. Until last year, 1 glass for men and half a glass for women was a recommendation. This year, there is no booze on the table. They say that any ounce of alcohol causes brain shrinkage. Learning a new skill. So a lot of people come to me and say, well, I do Sudoku, I do puzzles. That's not the trick. The trick is to learn a new skill, which is something that you've never done before. So for example, when you learn a new language, you gain the entire brain activity. So I got the 5 things, right? Cognitive exercise, which is learning a new skill, learning a new physical exercise, sleep, socialization, no alcohol, and then diet. So there's a diet called MIND diet, M-I-N-D. It's a combination of Mediterranean and DASH diet. And essentially, there are 2 take-homes. One is ditch the sugar and embrace the intermittent fasting.
Yeah, that's super insightful, honestly. Like, and that's I was super shocked that you literally said like, well, I have 5 points. But those are definitely the 5 points that we should take home from. I mean, those are definitely practical for anyone.
Yeah,
Uh,
yeah. Don't rely
yeah,
on the hospital. Don't rely on the hospital cafeteria. Cook your own meals.
yeah, exactly. Yeah, I guess the next question is that this person is asking, are neuro diseases usually isolated? I guess it's more so like is treatment approached in a way that it's only dealing within that part of the nervous system affected, or is it more so kind of a holistic process? I think this person also mentioned that um, they're more so referring to in cases of like neurosurgery.
Oh, yeah, yeah. So in neurosurgery is very, very isolated and very, very specific. So for example, when I talked about patients with Parkinson's or, stimulator placement, actually there is a very cool software that they use with MRI to navigate to the exact nucleus. So like GPI, globus pallidus interna, and VIM, ventro-intermediate nucleus is for tremor, GPI is for Parkinson's. So if you move a little bit side of it, even maybe slightly, tiny bit like the NASA launching, you're going to cause OCD, you're going to cause a lot of eating disorder, because all those areas are very closely mapped. When I was alluding to that 200, brain map locations, they're actually true. Now we are able to map very specific areas in the brain, which are very critical for certain functions. So for example, medial orbitofrontal trauma leads to apathy, not caring. Lateral orbitofrontal injury leads to being a teenage brain going compulsive, blowing up your money, making rash decisions and all that. So I think specific target areas are there for different neurosurgical interventions. There's actually now an area that's located for OCD. So there's a gene for PTSD called the TET gene. And there's a big ethical dilemma. Should we really treat that? Because your experiences is what makes you, even though your experiences might not be good on all accounts.
Gotcha. Yeah. I guess the next question is also kind of an interesting one. This person is asking your opinions on Neuralink, whether I guess they're developing their business responsibly, or do you see a promising future line in the business future paths?
I think, the BCI or the brain chip interface itself has a value. As we showed on the case where the BCI was used for patient that could not. So there are certain neurological diseases where you cannot enunciate because the peripheral end organ damage is there. I think that's where you will see a big, push. Whether it's going to come from Neuralink, we don't know that. There are so many other companies that are doing some fascinating job. I think the big thing is about, can the chips be used to enhance your memory? And I don't know that. I think that's going to be very fascinating. I think memory is a very complicated task. And to the question that was before, it's not localized to a simple pathway that you can fix. So language output is a very simple pathway, and that's why they were able to modulate that. But cognition, memory, judgment, you have frontal lobe, you have limbic system, you have executive functions. So many inputs come in. I think for that to happen right now is kind of tricky. One of the areas where I think this would be very helpful is in patients with spinal cord injury, who are on disability, who are paralyzed. I think that's where we'll see a big input. Some of the neuromedical companies are already putting, so the new prosthesis has the BCI of brain working with it. So when you move your leg, you just don't move your leg, your brain gets to understand how the leg is moving, what's the pressure, what's the speed, and what's the depth. So that's where I think the fascinating world is going to move towards.
Gotcha. Yeah, I guess one last question for today because the time is that like if one person wants to pursue a career in neurology, what are the major points that I guess like you would think that this person should keep in mind? And what are the signs that they could possibly know that they want to pursue it and enjoy this field?
I think that's a very, how should I put it? That's very tricky. I don't know. I'm just so passionate that I don't see the world outside my passion. So it's hard to say how other people would feel. Um, so a little bit of patience because neurology care is a long journey. So, you need to have a little bit of, patience on that. I think a lot of compassion. So one of the questions you had asked me for preparation was, how did I perceive myself a neurologist and what really became of me after I joined? I play a very crucial role in deciding the fate of our older patients who are living independently, driving, managing their finances, play a very crucial role in brain death and all that. So I think you have to put yourself outside the spectrum of a physician and almost be a family member. So number one, a lot of patience. Number two, significant amount of compassion. I think there's a huge burnout, in neurology purely because we don't see happy campers. We don't see migraineurs who come and bring us fruits and flowers. We don't see, patients with Parkinson's and dementia who are with us for a long period of time. And I think, how should I say? The third thing is a little touch of philosophy. I think neurology is all about philosophy, because there's so much about the brain that we don't know. And so the humility to accept that, I think, is very important. So I think if you have maybe all of these, the other thing is you have to find out if you're a happy person or not. I think we all have our intrinsic happiness. I think you need to see where that index is.
Yeah. I guess actually like I feel kind of bad because like this question has been upvoted a lot of times, so I've been ignoring it. And I guess this person is asking like Nicholas is asking about like what do you think about the theory that there were separate consciousness that reside throughout the
Right.
um
So
brain?
I'm big into philosophy, and there is a philosophy called non-dual philosophy. So the non-dual philosophy exists as this, okay? And the way I teach it to my Sunday kids is there's an iCloud, there's an iPhone, and there's a software, right? So iCloud is the universal consciousness, and we all tap into it. Okay, so your consciousness, my consciousness is essentially tapping into the iCloud. Now, in my body, in my iPhone, I have my own small portion of that consciousness, which is the software, right? And essentially, the body really doesn't mean much. It's a time-bound event, and the mind and the intellect also doesn't mean much. So if you go away from all that, then you are able to tap into this consciousness. So there are a lot of paranormal activities that happen. My migraineurs know when the weather is going to change. My epileptics know when their seizures are going to get worse, when the lunar calendar changes or when the changes. So that's just because they are more in sync with the cloud consciousness. So that's kind of a summary of it.
I see.
So Anil
Yeah,
Seth, I think one of the TED talk that I had him, and I think Antonio Damasio, those are very good TED talks. I would highly recommend looking at it.
gotcha. Yeah, that was a really insightful Q&A session. And I just wanted to take the time to thank you again, Dr. Pandey, for the amazing presentation and this Q&A. And thank you so much for sparing this weekend time with us. I bet our audience all learned a lot from you. It's a really cool presentation. Thank you so much.
Oh, I need you guys. I need you guys to take care of me as I grow old. That's
Yeah, exactly, exactly. It's like passing
it.
on the torch to the next generation.
Best of luck to all of you guys. I mean, we have a practice as and we do offer some offline programs. So anyone who's interested, can I would love to encourage more and more people to touch different aspects of neuroscience. Thank you so much for the opportunity.
Thank you so much. And for those of our attendees who are interested, I think all the links can be found in our link tree, which has been linked several times, but you can also navigate it to in the resources tab and in the, well, you can just pretty much find it from here. And for our attendees that are interested in ophthalmology, next session we'll have our amazing speaker talking about pediatric ophthalmology and a career path in that field if you're interested. So stay tuned. Our next session will be starting promptly at 10:30. And thank you so much again, Dr. Pandey, for your time today.
Best of luck to you, Michael, and to Alexia. Okay, take care, guys. Bye.